Hey, today I want to start by asking a question. Do you have a plan? A plan for what? How about a plan for what happens if you get sick? It's something that's really important for someone with diabetes to do, to know ahead of time what's going to happen to you if you get sick. The first thing that you want to do as part of your plan is to be sure that you have a current list of your medications. Really important for someone to know how to treat you or what's going on. If they know your current medications, it's extremely helpful. This form happens to have on the other side a list of your allergies, a list of your medical conditions, the doctors that treat you, the pharmacy that you use, other important information, including who your next of kin is or your responsible party. So this is a really important part of the plan. The next part of the plan would be to identify someone in your life that knows a little bit about your medical conditions or your medical history, including diabetes. It could be a family member, a trusted friend, someone from church, just someone that you could let know if you're feeling under the weather so that they could check on you and make sure that you're on the mend and that things are turning around in a good way. So, two really important things to start out with. Another part of the plan is to discuss with your doctor or your medical provider what you're going to do if you do happen to get sick. Things like, how should I treat a fever? How should I treat diarrhea? What should I do if I become nauseated and I'm vomiting? What should I do if I have burning whenever I go to urinate, use the bathroom? If I have a cough? These are all things that it would be really good to have as part of your plan so that you can have the appropriate medications on hand to treat yourself if need be. Some cough syrups, for example, have a great deal of sugar in them, so they clearly would probably not be the best thing for someone with diabetes to have. Okay? So making sure that you do have those things on hand. Another really important thing to have on hand would be some liquids that do have sugar in them. Kind of keep them tucked back in your cabinet, so if you do get sick and you're unable to take in solid food, that you would have something that you could take in and hold down. Maybe something like ginger ale or some other kind of soda that does have sugar in it, some juices, maybe Jell-O, popsicles, just making sure that you have something in your cupboard so that if you do get sick, you're not going to have to worry about what you're going to take in. Another part of your plan is to make sure that you are drinking plenty of fluids. Keep in mind that if we become dehydrated, our blood sugar goes up, and if our blood sugar goes up, we become more dehydrated. So, the other important thing to know is, what am I going to do if I have high blood sugar or low blood sugar? So, let's start with low blood sugar. If you are checking your blood sugar and your sugar drops down to 70 or below, you know that you need to treat yourself with some fast-acting carbohydrate, about 15 grams. We call this the rule of 15. Treating yourself with 15 grams of fast-acting carbohydrate, followed by rechecking your blood sugar again in 15 minutes. And if it hasn't gone up to 70 or over, then you want to go ahead and treat yourself again with 15 more grams of carbohydrates. Some examples of that would be 3 to 4 glucose tablets, which are really good to have on hand. Some kind of juice, about a half a cup of regular soda, Lifesavers, peppermint candy, some people eat honey, just so that you're getting some fast-acting carbohydrates in there to hopefully raise your blood sugar up. Another thing to think about is high blood sugar. Sometimes we can be bumping along doing really well with controlling our blood sugar, and then for some unknown reason our blood sugar spikes up and it stays up. That could oftentimes be the first sign that we are getting some kind of an infection, a virus, because normally if we have an infection or a virus, it causes our blood sugar to go up. So if your blood sugar is elevated several times for no known reason, that may be your warning sign that you may want to contact your doctor so that you can see if they want to see you or if they want to monitor you a little bit more closely. Also, if you are sick, you of course want to check your blood sugar a whole lot more frequently than you normally would to make sure that you're staying on track, that you're not suffering from highs, and you're not suffering from lows. So another thing that would be really important is to go ahead and know exactly what to do if you are having vomiting, if you are having a fever, if you are having diarrhea. American Diabetes Association says that if you do have a fever greater than 101 for 24 hours, you need to be sure to notify your doctor. Also, if you're having more than 3 or more episodes of diarrhea or vomiting in a 24-hour period, you need to notify your doctor. Another rule of thumb is if you just don't know what to do, you need to notify your doctor so that things can be headed off at the pass and the off chance that you do need immediate treatment to make sure that you're staying on track. Another important part of the plan is do not run out of your routine medications. Make sure that you have plenty of routine medications on hand at all times so that if you do get sick, you're not trying to figure out how you're going to get your routine medications. So, until next time, stay well, know what to do if you get sick, and don't forget, have a plan.